Hi, I'm Scott Blossom, and I am a doctor of traditional Chinese medicine and Ayurveda. I've been practicing that for about 25 years, and I also have a biology degree. So I'd like to present on subjects that integrate all of those different lineages of knowledge. Today, we're going to talk about superhydration, and superhydration, as defining it, it essentially is when you're actually really getting the water or the fluids that you drink to incorporate in a meaningful way into your cells and your tissues. And so, like, for example, if you chug a lug a bunch of water, mostly it just goes into your bloodstream, your kidneys filter it out, and then you urinate. Even something like an IV drip in a hospital is just hydrating the blood, and the real key factor is actually to have it move from the blood into the cells. So superhydration and cellular hydration are kind of synonyms for the way that I'm going to define it. And the reason hydration is so important is because it's foundational. It's like anything you do is supported by hydration. And if you're dehydrated, anything you do is going to be undermined by it. And so some of the modern research on it that's been very interesting is how it affects our mood, meaning that we can feel anxious, irritable, even confused when we get sufficiently dehydrated. It also is something that impacts our capacity to learn and to remember things and to take in new information. So a couple of key things to think about for actually getting to the place of superhydration. Number one is you can absorb about an ounce or two of water every 10 minutes. And that's the rate at which it will be absorbed into the stomach, and the body will have time to actually assimilate it potentially from the stomach to the blood to the cells. And so the process of getting it from the blood into the cells is the key piece. And if you over drink, you'll absorb a whole lot of water at once, but then the amount of water in the bloodstream will go up, and the body will kick in with the hormones and things that help you to filter out that excess of water. So you'll immediately start to have the need to urinate. And so in a few really key items for how you get this done. You can think of the image of the Japanese tea ceremony, or they have these little cups. I have some dear friends that I get to do with this, and it's great. And you have these little cups, and you're drinking like a half ounce of water every 3 to 5 minutes. And so at that rate, part of the ceremony is just to sit together and to drink. And so the masters within that tradition, and it is a spiritual tradition, sort of pride themselves on their ability to drink tea without having to urinate. And that's because they're absorbing and integrating the liquid. And so this is like an old, example of exactly what I'm pointing out, that you have to sip to get the fluids to really stay in the system. The fluids will stay in the system also if you are combining them with food, because you're getting sugars and salts and acids and those three things. And you can think of Gatorade essentially, which is a sweet, sour, and salty mixture, or coconut water as another example, where it has a structure where all those things being present actually helps you to hold on to liquids. Now, there's a real downside to always having sweetened beverages, as we can tell from the epidemic of obesity, as well as the fact that when you have something sweetened or even sour, it can trigger the acids in the mouth and actually weaken your enamel and have serious dental impacts. So it's good to learn how to drink things that are not sweetened or don't have something like lemon juice in it to hydrate. And that's when it really comes down to the rate at which you're introducing the fluids. And so something like tea is a great option, because especially if you're drinking loose leaf tea, you can keep steeping it and you're actually decaffeinating it in the process, but then you're still getting some of the alkaloids and the polyphenols and all the other good stuff that will actually help you to absorb and assimilate the water in the tea without having the caffeine. And so, as a side note, caffeine is a diuretic, but the good news is you have to have a lot of caffeine for it to have a meaningful diuretic effect. Like, for example, a cup of coffee has about 120 to 200 milligrams of caffeine. A cup of tea is about roughly a quarter to a half of that, depending on the kind of tea that you're having. And so you would have to have the equivalent of kind of 4 cups of coffee to have it really start to dry you out and really start to shift the body into a powerful diuretic effect, where you're going to actually lose more fluids than you gain. Alcohol is a powerful diuretic as well, and that's why it's so dehydrating. So a couple of other factors to consider. Fruits and vegetables have something called EZ water, and it's a structured form of water that exists in all living systems. We have it in our cells also. So if you want fluids that you're taking in to end up nourishing your cells, meaning the hydration moves from fluids coming into the blood to fluids coming into the cells and the tissues, then EZ water sources are a really great way to ensure that. So just think of juicy vegetables like celery or cucumber, juicy fruits like watermelon, but really all fruits and vegetables have them to some degree. It has the EZ water. Another important factor for the EZ water is sunlight, getting daily sunlight. That actually is how our bodies work. When we get ample sunlight during the day, our body will be better at creating EZ water in our cells. Another factor is minerals, and this is a big one because a lot of people are mineral deficient these days. Some of the main minerals are magnesium, calcium, sodium, chloride, potassium, sulfur. And again, if you're eating a wide spectrum of fruits and vegetables, you'll get those minerals in with your foods. It's really important to note also, though, that sea vegetables, seeds, and nuts are also really important. So if you're kind of, what the picture that's painting is, it matters a lot that you're getting enough vegetable foods to ensure that you can actually hydrate your cells. And that's the key to superhydration. A couple of other things just to consider is, the key sign of when you are superhydrating is that you're taking in fluids. About 1 to 2 ounces every 10 minutes is a nice rate, but you're not having to urinate right away. If you chug a lug, what ends up happening is you end up having to pee right away because you get too much fluid in the blood and then the body clears it. What you're looking for is that transition where the fluids are coming from the stomach into the bloodstream, but there's enough time for the bloodstream to actually distribute it into the cells. And so that quality, when that's happening, the key sign is you'll be drinking plenty of fluids, but you won't be having to pee any more than usual. And in fact, that you can sip fluids for an hour or two without having to urinate because your body's absorbing it. So I hope this is helpful and that you are, enjoy the benefits of hydration.